I'm Dr.Hamed. I'm academic lecturer in the Medical College of Suleimani University at the Northern Iraq, and meanwhile I am a spine and orthopedic surgeon working at the medical school hospital beside our college. The situation in the Northern Iraq is quite secure. There is no any kind of problem. I am just sometimes joking, I say it's even more secure than Southern California. There is no any kind of problems, as our locality is being protected and was a safe zone by the United States and coalition force for the last 16 years. Unfortunately, the healthcare, you can say it's a terrible or disaster situation in regard to the health system in Iraq. Healthcare, there's bad corruptions, and there is no reliable health system in Iraq. Who is rich, he can pay for himself, that's it. Who is not rich, it's for the God. So the health system is quite bad, and it needs a counseling of this system and beginning of another health system by the referral systems, having a family doctors. There's a big load on the doctors over there. We can talk about it for hours and hours. It's a bad health situation all over the Iraq. Imagine, for example, when I am in charge, every week I have got 1 day on charge. I should cover all of the Suleimaniya city, the population, which are about 2 million population. All of the accidents that relating to the upper and lower extremity and the back, I should manage that. Sometimes I am obliged to do more than 30 surgeries per night, because at morning I am in the college, at afternoon I am in private clinic, so the cases will be collected all over the day to have a surgery on them at night. And the amazing thing that I have got 1 assistant doctor but only 1 staff, so 2 doctors and 1 staff with 1 theater, and in the same theater that I am doing an abscess and a butt infected surgery, I am obliged to do a clean surgery, for example, a plating of the femur for a fractured femur, for example. It's a disaster. What to do with that situation? If there is no humanitarian help from the organization like Global Operation Giving Children Hope and other NGOs, most of it is from the United States. Thankfully, we are quite thankful for them. We cannot manage ourselves because of some unfortunate ethnic problems that we are Kurdish and our supplies are coming from the central government, so there's a lack of supply. So without the aid that some organization like Global did in the last 2 years, it sends more than, I think, as a guess, more than 6 containers of medical supplies that were quite beneficial, and we were lacking of these equipments. We cannot manage ourselves because so many population with so many deficient supplies.
What would happen if we were unable to send more containers of supplies? It
will be more disasters, and more kids and more children will be died without helping them.
So before we were talking about the laparoscopic equipment and what was needed. Can you touch on that?
Yeah. We had a laparoscope from the central government, but without its parts that are needed for introducing the laparoscope to the abdomen. Our hospital, teaching hospital in Suleimaniya city, asked from the health directory to buy these spare parts to be able to use the laparoscope. But for 2 years we asked for that, but the health office was not able to buy this equipment because it was so expensive. When we get supplies from the Global Operations Giving Children Hope, it was about 300 of these tubes. So from that time we get this equipment from the Global. No one was rejected to have a laparoscopic surgery on him. But prior to that, just the equipment was there without using that. Like a car, if you do not have a key, you cannot operate it.
Right. So how many people do you think have been whose lives have been touched but with laparoscopic surgery since?
I think for the last 2 years, more than thousands. Thank you very much, and we are ready for cooperation, and we are quite thankful for you forever. And what Global is doing is really amazing. We cannot express our thanks and gratitude to it.
So we want everyone to partner with Giving Children Hope to send more medical containers to Iraq, because it sounds like the need is great.
Yeah. It will be very nice from you, and I have got the letters from the health directory asking for more collaboration and more cooperation and more supplies from your side, because it was quite useful for us.
Great, thank you.
Thank you very much for your also.